Hi everybody, thanks for tuning in. My name is Dr. Andrew Thamboo, and I'm one of the sinus and skull-based surgeons here at the University of British Columbia. And today we're going to talk about the sinuses. So what are the sinuses? There are 4 different sinuses. 1's the frontal, 2's the maxillaries, 3's the ethmoids, and 4's those sphenoids. Now why the heck do we have sinus cavities? Their functions are multifactorial, to be honest. Smelling, humidification, warming, filtration are just to name a few. And those are all really important because not only does the air go through our nose, they eventually go to our lungs. Now, you're obviously probably seeing me is because you've got chronic rhinosinusitis, meaning you've got a chronic condition of inflammation of your sinonasal cavities. And that's tough. You're probably having a really poor quality of life. You probably have got facial pain, some nasal obstruction, potentially discharge, and loss of smell. You've likely had some form of treatment for this, but these symptoms continue to persist. So if these symptoms continue to persist after 12 weeks, you have chronic rhinosinusitis, CRS. Now, when we make a diagnosis of chronic rhinosinusitis, not only do we have to have those subjective symptoms, but you have to have objective findings as well. And that can either be in a CT scan or endoscopy. So what the heck is endoscopy? Endoscopy is when you come see one of our ENT doctors and we put a camera inside your nose. And what we're looking for are findings of inflammation, even discharge, and what's an obvious finding of chronic sinus disease is polyps. Now on CT scan, what we're looking for is chronic inflammatory tissue. Now, a lot of people ask us, oh, can we just get an MRI scan to find out about chronic sinus disease? And yes, you could, but most of us get a CT scan not only because it's more accessible, but because it actually helps us not only for making the diagnosis, but for surgical planning as well. What are the causes and risk factors for chronic rhinosinusitis? To be honest, it's multifactorial. Some of it's genetic, some of it's environmental, some of it's infectious, and some of it is just a combination of the above. And sometimes we just don't know. We really try to personalize our therapy. Based on our history, we try to figure out the cause of your chronic sinus disease, and our treatment plan is sometimes personalized to those causes as well. Now, how do we manage chronic sinus disease? Well, the first line of therapy is medical management. That medical management usually involves saline irrigation and nasal steroids. That nasal steroids can be nasal steroid sprays, but something that we like here is putting a steroid into a saline wash bottle and doing that twice a day. Now, we do have a link on that as well, so please check that out as well. Now, as I mentioned at the start of this video, if you've got chronic sinus disease that's lasting greater than 12 weeks, that means you have this condition. So you've likely been doing these nasal steroid irrigations for that time. And if you come to that point and you're still symptomatic with those subjective symptoms, which include pain, obstruction, discharge, and smell, we offer you surgery. And what does surgery look like? Surgery is actually done all endoscopically. That's what's amazing. We don't do anything external. We go through your nose and we do a whole new renovation. Think of it like a 1990s house. When you were in a 1990s house, you had a living room, a kitchen, a family room. And what we would do in this scenario, of this renovation, is we would go in through that front door and take down those inside walls. And the only thing you're left is with those outside walls. So when you go through that new front door, what do you see? Is a common cavity. A living room, a kitchen, a family room, all in one big common area. And why do we do that? We do that to optimize medical therapy. A lot of people think that chronic sinus disease can be just fixed with surgery. But the whole point of surgery is to optimize medical management. So by taking out those inside walls, we're able to flush this nasal steroids through the front door and all throughout the walls of those outside walls and out that back door very easily. And by bathing those outside walls, we're able to decrease the inflammation and improve your symptoms, which can include pain, obstruction, discharge, or loss of smell. So those are our goals when we're managing chronic sinus disease, is that the mainstay is medical treatment, surgery optimizes medical treatment, and hopefully that gets you feeling better.